Hello, welcome. My name is Miriam. I'm a family therapist, and this video is about children who are distressed or anxious during these times of coronavirus. I'm hearing from parents about children who say life isn't worth living and they want to die, or they want to move in with their cousin or with their best friend. All kinds of things that are very distressing for parents, and parents don't always know what to do. So this video is going to have three parts. First, I'm going to explain what's going on psychologically for most families. Secondly, I'm going to describe what parents usually do that doesn't work. And thirdly, I'm going to describe a two-step process to help you address it. And we'll tell you what to actually say to your child. So what's going on psychologically here? When I talked to these parents and asked what happened just before their children said these things, it turned out that in all cases, parents told them off. One was about a boy coming into the house from the outside, going straight to the toilets, and mom worried about contamination, reacting with quite a lot of anxiety. One was a girl that felt that her sister was getting a better treatment. All these things weren't really about the virus itself. It was about how we conduct ourselves when we're in a small space, when we're worried about our health. And this is where the children's anxiety is coming from. Having said that, sometimes children are upset because of other reasons, not to do necessarily with our attitude. It could be that they want to visit a friend and they can't. It could be that they're worried about somebody who may be ill. So whatever reasons your child has, this video is going to help you. And children are immature, and because of that, they will overreact to situations sometimes, especially some of them who are very, very sensitive and very intense. And they use very strong words. And so when they say, I don't want to live, it doesn't really mean that they don't want to live. It just means that they're very upset, they're angry, or they're scared, or they're anxious, they're distressed in some way. And it's almost like their mental alarm is going off, and they just say whatever they have to say to show us how they're feeling, to show us how difficult it is for them. So what doesn't help that lots of parents do? First of all, dismissing the whole thing and saying, oh, he's just doing it for attention. That really doesn't work, because again, if you compare your child's distress to an alarm system telling them that something's wrong, you're just ignoring the alarm. It's much better to listen to the alarm. So ignoring doesn't work. Even if they are doing it for attention, they're doing it for attention because they need our attention. The other thing that doesn't usually work is rationalizing with them, and that's basically explaining to them why they shouldn't be feeling what they're feeling, or why they can't have what they want. So for example, saying to a child that says she wants to live with her cousin, saying, oh, well, there's no room there for you, doesn't help, because she's saying it because she feels trapped, rightly or wrongly, in your home. You're telling her that she can't go elsewhere. It doesn't really help her. Also, asking why doesn't usually work, because a lot of the times children don't know why they're doing it. They're just upset. You can try. Sometimes you may get new information. A lot of the times you'll either get the information you already have, or your child's just going to say that they don't know. And just be careful also that you're not tempting them to lie. There's a video about it just here. So what can you do? Two steps, very important, and you have to do it in that order. Step number one is acknowledging how they're feeling. So you want to say something like, I can see you're upset. Maybe you are disappointed. Or you can say something like, yes, I can see you're angry. Things aren't going right now for you. Or something like that. And you want to allow them to feel that, whether they're right or wrong in their interpretation of what's going on. You want them to have their feelings and see that you understand their feelings. Think of the feelings as an alarm system telling them that something isn't right for them. And you want to, first of all, quieten the alarm. Let them know that you are hearing them. And then the second stage could be reassuring that it's temporary and it's going to go. It could be apologizing if you were too short and too anxious and told them off too quickly, too hard. It could be discussing what's going on between them and the siblings, or whatever it is that worries them. that's what you want to discuss, but that has to be second stage. Most parents that I talk to, I would say 80-90% of the parents jump straight to stage 2. And if you don't acknowledge the feelings of your child first, what's typically going to happen is your child's just going to dismiss it. Whatever you're going to offer, they're not going to want to engage with. They're going to argue with you and tell you that it's stupid what you're saying, and they're just going to be even more distressed. So first of all, empathy. It will help them to feel heard, understood, calm down. Then reassurance, explanations, rational thinking, all that. So this is it for me for today. Try it, tell me how it went. If you like this, please like, subscribe, share with anybody who can benefit from it. Enjoy your children. Health and safety to us all. Thank you very much.